Good morning.
Good morning.
Thank you for having me here today. Again, my name is Nancy Scott. I'm a retired registered nurse and a dialysis patient. I was diagnosed with chronic kidney disease, and I have been on dialysis for 4 years at a Fresenius facility in Newcastle, Delaware. End-stage renal disease. End-stage renal disease. These 4 words made me cry for 3 weeks. When I was diagnosed with kidney disease, I was at home, and I went to my doctor on a Tuesday, and he said to me, I said to him, I am just so tired. You have to do something. Something's wrong. He said, Nancy, you just do too much. Go home and lay down. I went home on a Tuesday, and I literally laid on my couch because that's like my comfort place, you know, your couch, your TV. And that Saturday, I couldn't get up, couldn't walk, couldn't see. I went to the emergency room, and the doctor kept saying, they took blood work, and the doctor kept saying, do you have kidney disease? I said, why do you keep asking me, do I have kidney disease? Of course I don't have kidney disease. I'm a diabetic, a type 2 diabetic that I control with diet. Well, finally he came in and said, you have kidney disease. Well, I cried and I cried and I cried. And that night, the nephrologist came into my room around midnight and said, you're going to start dialysis in 2 days. Now this is the nurse, the minister, me, start dialysis. Not me. You have mistaken. I want to see another nephrologist. You have made a mistake. This doctor and I, of course, became very good friends, and I did start dialysis that Monday. But as I've educated myself, I know that end-stage renal disease does not mean the end of your life. It just means the end of your kidney function. It didn't stop there. My daughter said, well, Ma, we have to have the same blood type. I'm going to give you a kidney. So I went for all the testing, and I found out I had breast cancer. So I had the double whammy. I went for radiation, 33, and I'm in remission now, thank God, for 4 years. And I have been listed on a transplant list. But when you have cancer, you have to make sure that, I don't know what the waiting period are in other states, but I had to wait 3 years before I could be listed. So that's my sob story, but I'm a very happy individual, and I really think everything happens for a reason, because I have just started so many things to help others with kidney function, and believe me, I have a very happy, productive life and a very supportive family. As an RN, an ordained minister, a member of the End-Stage Renal Disease Network for Advisory Board, a patient ambassador for DaVita Patient Citizens, and a dialysis patient, I have a unique perspective on the life-altering consequences kidney failure has on the individual, their family, and their community. I see many patients, and I count myself among them, who without a transplant to replace their failed kidneys are surviving and living active and enjoyable lives with the help of thrice weekly dialysis treatments. Yet at the same time, it pains me to see so many patients on dialysis when their kidney failure could have been prevented through early detection of kidney disease, as well as proper management of risk factors such as diabetes and high blood pressure. Patients can save their kidneys and avoid the eventual diagnosis of end-stage renal disease and dialysis treatment. If we are going to stop the growing tide of patients with kidney failure, it is very important to focus on prevention. National statistics show that Hispanics and African Americans are disproportionately affected by kidney disease, and that's because they are disproportionately affected by high blood pressure and diabetes, 2 of the leading risk factors. At my dialysis facility alone, 81% of patients are African Americans and another 7% are Hispanics. And nationwide, minorities are 2 to 4 times more likely to develop kidney failure. For the 400,000 Americans who depend on the Medicare end-stage renal disease benefit to pay for their costly dialysis treatments, living with kidney failure is made possible. In my small state of Delaware alone, more than 1,100 people need dialysis just to stay alive. Nationally, the incidence of kidney failure is advancing at an alarming rate and is expected to quadruple in the next 25 years. Thankfully, the Kidney Care Quality and Educational Act not only improves funding for dialysis, but it includes an important patient education component that will provide prevention messages for Americans who are most at risk for kidney disease. It is a very first step, an important step, towards halting the kidney failure epidemic in the minority communities and all over the United States that I see firsthand as a patient and as a healthcare provider and a community leader every day. Kidney failure is preventable. Kidney failure is preventable, and I hope Americans will have the opportunity to learn more about how to, at the very least, delay, if not prevent, end-stage renal disease. And I hope our voices are heard throughout Congress today. Thank you so very much.